The IDEA defines an infant or toddler with a disability as follows.
The IDEA defines infant or toddler with a disability as an individual under 3 years of age who needs early intervention services because the individual is experiencing developmental delays, as measured by appropriate diagnostic instruments and procedures in one or more of the areas of cognitive development, physical development, communication development, social or emotional development, and adaptive development, or has a diagnosed physical or mental condition that has a high probability of resulting in developmental delay.
Well, Jen, what does that mean?
You know, it sounds incredibly broad and vague, and it actually is broad and vague by design. Congress wanted the definition of an infant or toddler with a disability to be broad. And the reason is that unlike later when we're identifying students for special education services when they're school-aged, when you're dealing with an infant or toddler, Congress wanted us to be erring on the side of caution, basically, by providing services to children where we suspect there's a disability, but we're not 100% certain, because the whole goal is that ultimately, if you provide the appropriate intervention, the child may not ultimately be requiring special education services from their school district, okay? That's the whole point. So Congress was saying, let's make our definition pretty broad here so that it can be more inclusive as opposed to less inclusive.
Well, you know, sometimes it's very difficult at such a young age to determine that a child has a specific disability. So there's a lot of leeway in that broad definition to, as you said, to err on the side of caution.
Right, because you may suspect, in fact, there are some disabilities that you are not, by the protocols outlined by the diagnosticians, you're not even allowed to issue the diagnosis until a certain age.
Right.
So, you know, what might look in a 2 or 3 year old like a language disorder may ultimately prove to be dyslexia. What might look in a 2 or 3 year old like a behavioral issue may ultimately prove to be attention deficit disorder. But because we don't necessarily have those very specific diagnoses at a young age, but we know that something is maybe developmentally not quite on track here, we want to be providing those services to those students. So the IDEA is quite clear about that.